Now we simulate the treatment of a patient with a lower back pain, with an irradiation in the right foot. The area is located in L5 on the right. We have available a test that tells us that there is a paramedian right slip disc at L4 to L5 level with intraforaminal commitment. In the clinical evaluation, we have essentially established 3 treatment grounds. The first is to act directly on the emergency of the spinal nerve of the vertebral column. The second is to act on the Valiax point of the midpoint of the thigh. And the third is to act on the quadratus lumborum, on the side of the irradiation, because there is a painful scoliosis. We will do this with the application of an harmonic pulsation at the level of the spinal nerve of the vertebral column, with the application of a superpulse at the midpoint of the thigh, and with the application in continuous mode on the area of the superficial radiance of the quadratus lumborum. In the main menu, we access to the option Laser. In this case, we have established to use the open mode. For the first phase of treatment, we choose harmonic pulsation as wavelength, the 1064 nanometers, and the program goes to the automatic setting regarding the wattage and the energy. We set the QMD for the first phase of treatment, so harmonic pulsation, we identify the treatment point along the iliac crest until we find the spinal nerve. We move just proximally. We are on the gap between L4 and L5. At this point, the glasses are worn. The interlock is closed. We can start with the treatment. Small spacer. For the second phase, we choose the superpulsed mode. The wavelength is again the 1064 nanometers, and also in this case, the time, the watt, and the energy are set automatically. We use the pointer without any spacer. We localize the point of the Valiax in the midpoint of the thigh. We apply the pointer with extreme compression on the skin, leaving it fixed, and we start the treatment. For the third phase, we choose the continuous mode, the wavelength of 1120 nanometers. We set the energy density up on the 10 joules per square centimeters. And we fix the treatment area. In this case, it will be about 20 centimeters per 10 centimeters. In this case, the QMD proposes a power of 5 watts, which can be modified by the operator. The treatment area is that of the quadratus lumborum of the right half body. We apply the medium spacer. We start the treatment, moving the applicator along the direction of the muscle fibers.